We are trying as a think tank to come and meet people and communities around the UK. So we're here today in Birmingham talking to people from a whole range of different backgrounds about these really key issues that are facing the NHS. We want to engage with people directly about our research and to ensure that they have a say in the future of the NHS. More and more people are being expected to have to pay for their own healthcare costs. This has happened partly because the funding going into the NHS has been constricted, but also because of the fact that the private sector has grown to such a significant degree that it's now actually able to meet that growing demand which has arisen because of the fact that the NHS has shrunk so much. Our concern is that if you grow the private sector to such a large degree, it doesn't need to look after NHS patients. It can just turn its attention to those people who have got the money to be able to pay privately.
The most important messages were that we need to change, that the way that the things are moving currently is not really meeting the needs of our population, and really we need to keep them at the heart of what we do.
What was fascinating for me was the particular focus on secondary care. And for me then I have to think about, well, how can I ensure that from a population perspective we enable people to understand more about what's going on so that they can make better choices and so that they don't end up having to need to use the secondary care system.
What was really important was actually the level of interest in the general public for thinking through some of these issues that we've got, and the opportunity to perhaps reflect a little bit about how complex the issues are that we're dealing with, and actually the work that organisations are doing like yours to be thinking about actually how do we get this up the agenda, and to realise actually we're going to have to think quite radically differently about what do we want the NHS to be to avoid this kind of trap of a two-tier system.
For me, the biggest risk is an exacerbation of health inequalities. Specifically, the people who are most in need of the care aren't going to be able to either understand the system or be able to afford to receive it.
What I see in particular in Birmingham is that we have pockets of severe deprivation, people unable to access health care as it is at the moment.
We saw through the pandemic the impact that it had disproportionately on underserved and underrepresented communities, and I think that's the greatest risk of having an increase in a two-tier system where those who can pay and get seen quickly and treated and those who can't have to wait.